And welcome. We are already in week 4. Isn't that something? It's just zooming through. And today we're going to talk about informed consent, which is one of my favorite topics because the U.S. Constitution provides a guarantee that every patient, every person has the right to say no to any treatment, procedure, or service. As a matter of fact, if a physician or any healthcare professional touches you without your permission, they can be charged with assault and possibly assault and battery, depending upon what happened. Okay, and that is true, and it has happened. Okay. And if we're going to empower every person with the ability to say, yes, I agree, I will have that procedure, service, or treatment, or no, I don't want it, you can't just make this a willy-nilly decision. The patient has to have information upon which to support their yes or their no. Okay, so this is, we're going to go over the components of informed consent, and hopefully you will understand exactly why this law exists, because it is so important that the patient have the information they need to decide, yes, I'll have that injection. Yes, I'll have that surgery, whatever it might be. Okay. All right. So first, I wanted to start out with going through the fact that there are 2 types of consent. The first is known as express consent, and express consent is actually you signing a piece of paper or on a tablet that says blah, 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 blah. Yes, I agree to this surgery. Yes, I agree to this examination. Yes, I agree to this treatment. Okay, it's in writing, whether it's in digital format, like I said, on a tablet, or a piece of paper that they give you, you sign your name. That is express consent. Okay. Implied consent is consent based on the patient's actions or conduct. So you may remember the first time you go to a physician, you will sign a consent to treat form, or, you know, again, it's part of the new patient package, and that is express consent that you're permitting this physician to treat you. But in later visits, they don't ask you that every single time. But so therefore we go by implied consent. In other words, the patient walked through the door, sat down in the exam room. That is implied consent, that the patient is agreeing to meet with this provider, accept whatever's going on, although it's not blanket. I mean, you have the right to say no at any point in time. But the fact that the patient showed up, the fact that the patient walked through the door is implied consent based on the patient's actions. Okay? All right. So now we're going to look at the 6 components of informed consent, and we're going to go over each one individually. So just to do the overview, explain the procedure, and essentially why is this procedure being recommended by the provider? What are the benefits regarding the diagnosis? Okay. There are risks to every single procedure, and the provider is obligated to explain those risks. The benefits and risks of not having the procedure. So it needs to be explained to the patient. Well, what's going to happen if I say no? Okay, is my arm going to fall off? All right. Explain alternate treatments. So this may be medication instead of surgery, or acupuncture, or chiropractics, or anything that is considered complementary or alternative treatment that might benefit the patient without the being discussed procedure. Okay. Confirm the patient's ability to understand this information and make a decision. Now, well, and again, we'll talk about this in depth a little longer, but you know, when you're discussing something and I'm providing you with information for you to make a decision, yes, I want this, no, I don't want this. At some point, I have to say, do you understand? Do you have any questions? Are you okay with this? What, you know, we're having a discussion. And that is the patient's responsibility as much as the provider's responsibility, because they don't know what's going on in your head. They don't know if there's a big question mark in there, or if you're going, okay, I understand, I can make this decision, I feel confident. Okay. So that's very important. And then everything must be documented in the patient's chart. Okay. And that includes the conversation that was had, as well as asking the patient to express consent if it's surgery. Sometimes just implied consent is okay. Like if I agree to get a flu shot, okay, I'm there in the exam room. Yes, okay, the nurse comes in. Before she sticks the needle in my arm, I still have the right to say no. Okay. All right. So let's look at this a little further. So explaining the procedure and the benefits regarding the diagnosis in layman's terms. And that's the provider's responsibility. They must explain what is going to happen. Are you going to wheel me into the operating room and then given general anesthesia? Or is this going to be in a procedure room and you're just going to use a local or regional anesthetic? What's happening? What's going on? And this is expected to fix your whatever. Okay. And why this procedure is being recommended over if there are alternatives. Sometimes there are alternatives. And the risks of having the procedure. What does the patient need to worry about? Now, of course, every provider is going to say, oh, you don't need to worry about this. I've done this 1,000 times. Okay. So maybe the word worry is not appropriate, except as a patient myself, as a patient yourself, we all become patients at some point. You need to know that there's going to be something. So risks of general anesthesia is certainly one of them. The risk of death. Okay. I don't know. It all depends on what the procedure is. But the fact of the matter is, they must be discussed. Now, I have read some articles of some physicians who don't like to discuss this because they feel so strongly that the patient should have the procedure that they don't want the patient to be scared and say no. And I understand that point of view, okay, kind of like in a few terms, or wherever you are in your education, we your faculty members are going to recommend strongly that you sit for a national certification exam, because it's very important to your future career. Okay. Now I could tell you, yes, it's scary. Of course it's scary. Okay. You pretty much cannot die from taking a national certification exam. Okay. But you see what I'm saying is they don't. So if it's not volunteered, the patient must take the responsibility to ask. Okay. Because how else can you make a valid discussion. How else can you say, oh, I forgot to tell you I'm allergic to that anesthetic, or I've been taking aspirin, which could thin my blood, which would make me bleed out faster. It's got to be a conversation. Okay. Refusing the procedure. The patient needs to be made aware of the pros and the cons, the benefits and the risk of saying no, because this is their right. This is their U.S. constitutional right to say no. But they also need to understand the risks of saying no and the benefits. Okay, there might be benefits. Sometimes also surgeons might hesitate. Oh, wait, this is the next part. Okay, what are the alternatives? So this is the part I wanted to tell you. There are some surgeons who believe so strongly in surgery that they don't even want to discuss the possibility of medication with the patient, because they don't want the patient to be on medication the rest of their life, rather than having one 90-minute surgical procedure and be done with the whole thing, right? And that's easy to understand, right? From their point of view, but it's not your point of view that matters. It's the patient's right to know. Yes, there's a medication you could take, but you're going to have to take it 3 times a day, every day for the rest of your life. And it costs $15 million a month. Okay, that's fine, but the patient has the right to know. Okay, would acupuncture, chiropractics, physical therapy, anything else provide benefit without the surgery or the whatever? Okay, whatever it is. Okay, I mean, remember, we could be talking about chemotherapy, immunotherapy, in addition to a surgical procedure, or whatever else there might be. So this is not solely for surgical procedures. And for those of you who don't know, informed consent was actually developed for the protection of research participants. If you're going to participate in a clinical trial, and this is one of the lessons learned from the Tuskegee experiments. If you don't know about that, you should look it up. A shame of our history in the United States and in healthcare. Okay, so now we understand it's not just about the research goal. All right, confirm the patient's understanding. They have to understand the information or they can't make an informed decision. Just can't happen. So it might be just, do you understand what I'm saying? Okay, do you have any questions? Do you want to go ahead? Or if there's a question about the patient's understanding, maybe the patient is in a state of confusion. Maybe the patient has dementia or early Alzheimer's or something like that. Then the physician, depending upon the extent of the procedure, might want to bring in the patient's healthcare surrogate, typically a family member, okay? Or maybe a psych consult. In other words, have a psychiatrist come in and do a mental acuity exam. If it's a serious procedure and there's real question about the patient's ability to understand. This is for the protection of everybody, the protection of the patient and the protection of the physician and the staff. Okay, so let's respect the patient. Okay, we want this. That's what this is about, is respecting the patient. And then everything must be documented so the coders can code. Now, understand that as a professional medical coding specialist, there is no code for informed consent. this is not something that would be coded, but let's remember that we in the Health Information Management Department are part of the backup team to the clinicians to make sure that everything that's supposed to be documented is documented. And you might say, well, why is it my job to protect that doctor from malpractice? Well, it is and it isn't, okay? It is because it protects the entire facility. No, you know the old saying, no man is an island and no woman is an island. No doctor is an island. You're all part of the care team. And secondly, protect the patient. That's your job. Okay. And don't you want that for you when you're the patient? Yeah. It's the job. Make sure that it's documented, because if the doctor goes down, you might go down too. Okay. Now you might say, well, if I'm in a big hospital and there are lots of doctors, yes, chances of you going down are going to be slim to none. Okay. But if you're working in a physician's office and there's only one or two physicians there, and this physician gets caught, and there's a penalty of, I don't know, $25 million, how long do you think the practice is going to be open? Right, exactly. All right. So just for the ethical part of this course, for the ethical part of humanity, one thing that right now, not only in the world, in the United States, there is so much vitriol. There's so much killing. There arbitrary killing. There's so much hate. How about if we combat that with empathy, understanding, and caring, which, yes, is part of our job. Okay? I'm just saying. All right. Chapter 7 is your reading for this week, and your homework for this week, and your quiz for this week. Isn't that, you like the way the theme goes? Right. Okay. And I did post some extra stuff about informed consent in the course. Okay. Yes, the physician himself or herself must have this conversation with the patient. However, again, we're a team. The nurse is probably going to be the one to bring in the consent form to be signed. And again, we are the backup. We are there. We're reading back through the documentation to make sure that everything is there. Okay? All right. Any questions? I hope you have found this to be informative. Oh yeah, that's bad when I laugh at my own jokes. Okay, so you know the deal. Anytime, 24 hours a day, you have a question, you can email me and I will respond within 24 hours with an answer. Okay, and then we can email back and forth. We can make an appointment to talk on the phone. We can Zoom one-on-one. We can FaceTime. We can do WhatsApp. Okay, whatever you need, I'm here to support you. I'm here to help you learn to ensure a successful career for you after graduation, and that you can take part in my desire for us all to go out there and make things better. Okay? All right. Have a great day. Have a great week. I'll see ya.